Hello, in this video, we're going to talk about cardiac output. So cardiac output is defined as the amount of blood ejected by the heart in 1 minute. So here's a heart in systole, and the ventricles are contracting, ejecting blood out to the aorta and the pulmonary trunk. The cardiac output is defined by the amount of blood ejected by each ventricle in 1 minute. And there are two factors that are used to calculate the cardiac output. These are your heart rate and stroke volume. Your heart rate is essentially your conduction system of the heart. Your heart rate is how many beats per minute, so beats over minute. The other factor is your stroke volume. Which is the volume of blood pumped by each ventricle with each beat. So this is mils per beat. So therefore, cardiac output is equal to stroke volume multiplied by heart rate. And stroke volume is mils per beat and heart rate is beats per minute. So as an example, a normal stroke volume would be about 70 mils per beat and heart rate about 75 beats per minute. Cross the beats out and your cardiac output is 5,250 mils per minute. And this is about 5 liters per minute, which is about right because the amount of blood passing through the heart each minute is about 4 to 6 liters. So the heart rate and stroke volume is used to calculate cardiac output. But there's another 3 factors which influence stroke volume. And so in total, there are 4 determinants of cardiac output. Let's take a look at these. So the first determinant, which we already talked about, is heart rate, which is your conduction system. This is how many beats per minute. And there are things that can influence your heart rate, known as chronotropic factors. So you can have positive chronotropes, which increase your heart rate, and negative chronotropes, which decrease your heart rate. An example of positive chronotropes is your sympathetic stimulation. Your adrenaline, noradrenaline, epinephrine, norepinephrine, these guys will increase your heart rate. Some drugs can also increase your heart rate, such as atropine. Negative chronotropes decrease your heart rate. This is your parasympathetic activity, so this is your acetylcholine. Some drugs, such as adenosine, can also decrease your heart rate. The next 3 determinants of cardiac output are the things that influence your stroke volume. The first being preload. Your preload is essentially the amount of blood entering the ventricles during diastole. So it's also known as, your end diastolic volume. Again, the preload is the amount of blood, the volume entering the ventricles, and this is during diastole. Preload can be influenced by, therefore, venous return, the blood volume, and also atrial contraction. And the preload again occurs during diastole because this is when your ventricles are being filled with blood. The next determinant of cardiac output, the third one, is afterload, which essentially occurs during systole, when your ventricles are contracting, ejecting blood out of the aorta and into the pulmonary trunk. Your afterload is essentially the resistance the ventricles must overcome to circulate the blood. And so you can imagine things that can increase your afterload. These are things such as hypertension, atherosclerosis, and vasoconstriction, because these things will increase the resistance and therefore increase afterload. The fourth determinant of cardiac output is contractility. This is how hard the myocardium must contract for a given preload. And there are things that influence contractility. These are ionotropic factors. There are positive ionotropes which increase contractility, and then there's negative chronotropes which decrease contractility. So positive ionotropes, again, is your sympathetic stimulation, noradrenaline or norepinephrine. Some drugs such as dobutamine can also increase contractility, making it a more powerful contraction. Negative ionotropes are things such as your parasympathetic stimulation, so your acetylcholine again, and some drugs can also decrease contractility, such as your beta blockers and calcium channel blockers. So those are the 4 determinants of cardiac output: your heart rate, preload, afterload, and contractility.